I can tell you that I did not take up to 3 of those recover. I started spinning. My eyes, I lose focus, headache, all my system just change drastically. You know, he was telling the father, if I come out here, I go smoke, I go drink. I say, if you smoke, you drink, who are you killing? Is it your father? I say, because the man is even begging you. I say, you should open gate and let him go and drink. If who will have the liver problem, who will have the kidney problem? Is it not you? Is it your dad? Where is your father begging you? I say, okay, beg you, because you are begging him, that is why he's shouting back at you. The man say, he's my only son. That is another problem. Why are people going into drugs? Parental overprotection.
Why are people increasingly drawn towards drug use today?
I would say the society is part of it. Because we are living in a society, we have rat race. People are just moving. Parents are no more concerned about what their children bring home. The only person that cures addiction is Jesus. You must be ready to surrender before addiction will go. If you are not ready to surrender, you will live with addiction. Because for drug users, the onus lies on the person, the user himself. If he feel that this thing I'm taking is not good for me, that is the only person that can stop it. You can always take the person to a rehabilitation center and the person have not seen the effect. They will still be where.
My name is Miracle Ifai and I am your host. Today we are going to be talking about a very interesting topic. We're talking about hard drugs, addiction, its effects on youth, and then how we can overcome it. I'm not be doing this alone. I'm here with Mrs. Otogun Izebua, a seasoned psychiatric nurse, Assistant Director, Psychiatric Department, University of Port Harcourt Teaching Hospital. You're welcome, ma.
Thank you, Miracle. Welcome. Thank God for this great event. At least recently, over the world, we are talking about drugs, how it's affecting the youth. There was even a musician in Lagos sometime last week who also brought about this issue. That means the awareness is everywhere. Thank you.
Thank you very much. So we have some interesting questions that I would like to ask her and she will give us our expert advice. So the first question is, want to know what exactly are hard drugs and how do they affect the brain, especially the teenage brain?
Hard drugs. What is drug first? Before talking of hard drugs, what are drugs? Drugs are things, substances we take for treatment, either for prevention or for treatment of any disease. And these drugs can be legal or illegal. So talking of hard drugs, what are actually hard drugs? We have both prescription drugs and illegal drugs. Those are the ones we call hard drugs. We call drugs generally drugs of abuse. When you take a drug or any substance you take that is not prescribed by a doctor, we call it an abuse, whether in medical or in the local palace. It's an abuse. You are abusing it. You can abuse paracetamol. You are not having any pains, you abuse paracetamol. You just see people say, I'm having headache. You go to the counter, I need paracetamol. It's an abuse. That is a drug. They are abusing it. I won't talk of hard drugs. We call hard drugs, those are drugs that are under strict control by the NAFDAC and the NDLEA, those people in charge of drug in Nigeria, like cocaine. We have heroin. Those are the hard drugs people are talking about. We talk of marijuana. Another local way, we call it Igbo, Indian hemp, Bana. Those are marijuana. We have other drugs like amphetamines, methamphetamines. Those ones we call ice. Those are the amphetamines, the methamphetamines. Then I told you of prescription drugs. There are some drugs that are prescribed, but people start abusing it for the purpose which is not meant for, like cough syrups. You know, there was a time in this country where cough syrup was banned, that is Benelli with codeine. But people start abusing. See, our youth start putting Benelli with codeine inside drinks. our beverages. We put inside Coke, inside 7 Up, just to get a high effect according to them. Then we also have tramadol. Tramadol, they are used for pains. They take it, they will call them, those tramadol is under opioids. We have the opioids prescription. These opioids are used for deep pains. Tramadol is one of them. Then we have pentazocine. Pentazocine is an injectable. Just that I'm not with my phone, I would have shown you most of our pentazocine patients how they've injected themselves and they now have sores on their body, even leading to the ulceration, big ulcers on their skin. Pentazocine abuse. Then these are prescription drugs that you can prescribe for. Pentazocine, patients that mostly use it are people that had surgery, and our sickle cell patients, they use it because of those pains. They used to have pains in the bones. That's when they prescribe it for them. But you see, people start abusing it for no reason. And how does this thing affect their brain? Gradually, it starts destroying the brain cells. Is one of the cells. Once it's damaged, it's a permanent damage. So when they start taking it, it affects their cerebellum. Before you know, they get used to it, that it affects them, their memory. It affects their first of all, work on their
cognitive ability.
Their cognition, everything about them starts going down.
And that would lead me to the next question, that why are young people increasingly drawn towards drug use today?
I would say the society is part of it. Because we are living in a society, we have rat race. People are just moving. Parents are no more concerned about what their children brings home. Is just go there, make whatever you want to make of yourself. Parents are, why I say rat race? Why? Parents, the economic is biting hard. Parents, the home is supposed to be the first place for a child. But you see, these days, parents don't have time for their children. Everybody out in the morning. When they come back, whether that your child go to school, you are not bothered. You don't even know. Your is that you dropped your child in school, or you have paid school fees and my child went to school. When that child get back home, whether in the hostel, you must always come back home. Have you find time to ask that child what happened in the school? How is the academic environment? How is the course you are studying, or those in secondary school? Because even in primary school, they go into drugs. So peer influence. Some parents are taking drugs. They do drugs. So their children don't see anything bad in it. I remember one of my patients who told me that his father smokes. Why has it not affected his father? I told him, your father smokes. Do your father smokes in their hand? He could not answer that question. He said, I don't know what he smokes, but I know he smokes. So parental influence is there. If you smoke, some of these smokers, they inherit it. There are some women that smokes. So when you smoke and you are pregnant, your child inherits it. There's a gene. So some children inherit it from the gene, either in their mother or in their father. Then peer influence, the peer groups. Some youth don't have the willpower to say no. They just want to belong. This my circle of friends, everybody do drugs. Let me even follow, so that they will not say I'm a Jew. At the end, you are destroying your brain. Let me give you an instance. I remember my year 2 when I was in the school in Benin. I went for a friend's elder sister's wedding. On getting there, in the wedding reception, there was no soft drink. So every table was filled up with alcoholic drinks.
That's your wedding reception.
I was just like,
you don't want to get
the waiter serving, I called him. I said, I needed malt. He said, there's no soft drink. I said, what of fruit juice? He said, nothing. It's all these things that are here. I looked at the whole place. Even those students that when we were in school that will look at them like they are baby, their parents will come and drop them in front of school, come and pick them. They were all drinking. Some have even taken up to 2 bottles of Star Gouda.
Wait.
I say, hey, so they will now look at me that I am now a Jew. And I told the man, I said, give me small start. The man brought the small start to my table. I've never tasted alcohol in my life. I can tell you that I did not take up to 3 of those cover. I started spinning. My eyes, I lose focus, headache, all my system just changed drastically. So I was like, what is happening? At first I didn't know it was that alcohol that I was taking on. But I just know my system, everything changed. I pause. The person that went with me from my own hostel, and I say, Zebo, you want to spoil our show? Because that one can drink. Say, you want to spoil our show? When they don't already drop 7 for here, now I for the balance. I said, let's go. My body, I don't know how my body is doing me. My tummy, that I feel as if this house is turning me. So she was angry. But she don't know the people. And I was the one that took her there. We left the venue. I met my friend, my secondary school friend. I said, maybe I'm going, please. That my sister say, they never even start. You don't they go. She just gave me my package. I left. Get it to the hostel. Everybody was saying, no, you people wait. Hey, now food will go chop. The other girl was telling them, they just started. Oh, this is a boy. I don't know if they worry am. They were even calling me Ogbanje. That my Ogbanje started there. Didn't even say anything, but I didn't even know what was wrong with me. I was so disorganized. There's one of our classmates, we used to call her Mama because she's elderly. She now said, my dear, what is wrong with you? I said, I don't know. She now gave me garri to drink. And she just missed that garri for me to drink. Started vomiting. That was how that alcohol, this thing, everything started pouring out. Hey, just student now. Deeper life. You want to drink alcohol, we must go and tell Kumuyi. That was where my whole system stopped. Immediately I vomited that thing. The whole thing. The food I carried, they ate it. They said if I had died, I would not have known that there was food they gave me. That is. But what am I saying? I noticed that change immediately and I stopped. But today youth, they will not stop. They want to go more. So that is why the influence, the circle of friends we make matters a lot. And also our environment is everywhere. You tell your child, don't move here. What of the next place you are moving to? Be everywhere. So what am I saying? Our environment, environmental influence is also part of it, of the use of drug, this thing. Then we talk of medical. So because of some ailment, some people abuses drug. Once they don't want to feel that pain, like sickle cell, I told you, the pain. To endure it is a problem. Just I want peace. Like people that do surgeries, once they give them pentazocine. I remember when I gave birth to my last child 4 years ago, the nurse was giving me the pentazocine injection. I noticed anytime it gives me that injection, I'm always floating. I'm not sleeping, I'm not awake. I'll just be floating. So by 5 p.m. he came again. He came with 2 different injections. He said, Madam, I want to give you your injections. You are due. And I said, please, what injection actually are you giving me? That I need to know the drugs you are giving because I deliver in a private hospital. They now told me that it's pentazocine and paracetamol. I said, please, I don't need the penta. Give me only the paracetamol. He said, the doctor said he don't want you to feel pain, that you are his friend's wife. I said, that is why I want paracetamol. Maybe I did surgery and I had a cut. Allow me to feel the pain. If I don't want to feel pain, I would not have come for a cut. So he said, Madam, you are the first person that is telling us other women will be craving for it. I said, I'm not other women. Give me. She didn't know why I was saying. I said, these are people I treat. I manage pentazocine. So me, I will not become an addict to pentazocine. So you just have to know what works for your system.
Yeah. Thank you very much, ma.
You're welcome.
I would like to ask, can you share a real life case of where the abuse or the use of hard drugs actually affected a student's life without mentioning names?
I have a lot. It's not only the student life, there's broken homes. There are marriages that have been destroyed as I'm talking to you now because of a child use of drugs. I have a lot of cases. Even there's a present one that we are dealing with, how to help the couples come back. The man keep on, we parents, I used to tell them that when the Bible said a good child is the father's joy, but when a child is bad, it's the mother. So I tell my mothers, I say, always take the blame, and your knees should be on the floor for God to change your child. Because if the child is good today, the glory will go to the father. So don't quarrel. I've seen a lot of broken homes, families have been divided. I have some students that went to good private schools in this country, Alfa Babalola, where they could not complete their education. There was a case 2022. The boy was a final year student of engineering in Alfa Babalola, could not complete his education because of the use of drugs. The father keep on calling, please, how do you help me? I said the help is for your son to stop. Addiction is a bad thing. It's better you don't go into it. I tell my patients, addiction, the only person that cures addiction is Jesus. You must be ready to surrender before addiction will go. If you are not ready to surrender, you will live with addiction. Because for drug users, the onus lies on the person, the user himself. If he feel that this thing I'm taking is not good for me, that is the only person that can stop it. You can always take the person to a rehabilitation center and the person have not seen the effect, he will still be where he is. Then the academics, you see, most of them don't continue their education. In the future, they'll start blaming it. You see, like a case we had, this one even graduated but with a third class. This is somebody that all throughout his primary and secondary, in his secondary school in Graceland, all his 9 subjects were A1, came out with third class. Will you believe that somebody with A1 can come out with a third class? And that third class and it was in a private university where the father was just pleading, let my child. The boy can't remember anything again. If you are talking to him, I know I will stop, I will stop one day. I say you will stop one day with a third class. Where will you get job? You can't even go for your PGD. The parents are already confused, they are tired, because and it's their first child. If they think of the money they've invested in that child, they are even saying, I think the younger brother was fighting him the other day, that the brother made them not to go to private university, but their father have to force all of them to UST where he will be seeing them. So you see that the problem is enormous in the family, among peers, among siblings, there's sibling rivalry. Then the person in question, the abuser, have lost socially, academically, because some of them able to learn a skills, they can't cope because of their memory. Little thing they doing off like that. So
That's it.
there are a lot of problems.
So now, what are the early signs that parents and probably students too should look out for to know that this person is beginning to take drugs, in order to prevent it?
There are lots of signs you can see as a parent. That is why I told you, if a parent that the eyes, let me use that word, the eyes are down, you know your child, you know the behavior. We call it pre and post. The pre or the pre is before your child enters school, you know what he or she is capable of doing. Then in the period, that period while in the school, you know some of the behaviors he brings home, that you should be able to say, no, I know you, my daughter, when you were at home, you were more religious. Now, you just went to school for one semester, come back, even to read your Bible is a problem. You should be seeing those signs that, no, these are not good signs for me. Then, if it's a child
that is changing behavior,
yes, there's change. The change is drastic.
Drastic change.
If it's somebody that likes cooking, anytime he comes home, mommy, I will do the dish today, and you just go and relax. You just say, him or her will just go. You just
like
ignore
social
him.
withdrawal.
And there's withdrawal. Those things that used to interest him, no
No
more
more.
interest, him or her. He's no more interested in the cooking, in the music, in anything
Mm.
that you think of that he loves, those things he derive pleasures in.
Mm.
He no more have pleasure in them again. There's social withdrawal. Some of them, the appetite keep dropping because they replace it with food, especially those people taking cocaine, marijuana and tramadol. Like my tramadol patients, you will see them, they will not eat. Instead, they will be drinking water.
Mm.
They will be drinking water. They will be drinking water because say that water keeps them healthy, strong, so that they will not fall. Ehen. Because the drugs
That's
always
serious.
feed their
Stomach.
stomach.
Mm.
So they're always
That's
drinking water.
that's
Then
terrible.
there's weight loss. Somebody that is not eating will have weight loss. There's weight loss. Then some of them always drowsy. Drowsiness is there. So you see somebody will sleep the whole day. How can a student be sleeping the whole day? Drowsiness. Why some of them steal, some of them be doing pickpockets. A child that doesn't steal before, suddenly you can't drop your bag, can't drop anything because it will go missing. You start
Mm.
picking things, selling of their own properties, selling. If it is the one that mommy, this my trouser is now undersized, I want to give it out. This time it's not thinking of giving it out again.
It's to sell.
It's to sell, exchange it.
So I
Even the
can
phone,
use money to
yes.
buy
They sell their
these
phone, they
drugs.
sell everything and anything they can sell. Anything that is sellable, they sell. I have a father that took his 7-year-old son to sell because of cocaine. He could not afford. He has smoked his car, he has smoked other things, then he needed more. The craving is high, and cocaine is not for the small boys, for the big boys. He took the son, he went to the school, picked the son, and those people, the dealers are the one connecting them to who will buy it. And God just did miracle that day. I would say it's miracle. The boy wandered away from where his father was, still with the uniform, wandered away to the 4 compound from where the dad was. And while he was there, he could not retrace his step back. The woman was cooking, say, come, where you from dey come? My daddy, a 7-year-old boy, you should be able to say something. Which one be my daddy? You don't know? So as the woman was shouting, abeg o, dis dat, where they are now is always in an enclosed place, so they were busy enjoying themselves. The boy was just, my daddy. That was how a passerby now say, I know where dis school is. Maybe if we take him to this, maybe he was kidnapped, or maybe the
Mm.
father was kidnapped, and this one now have
Mm.
wandered away. They didn't know it was his father. Took him this time, I'm telling you, was around 6:30 p.m.
Oh.
Took him back to the school. The security say, where una for see the pikin? Na him father come carry am na. He say maybe they don kidnap him father, that they saw him in one compound. He say, my daddy, my daddy. The security person called the proprietor of the school. Proprietor say, they call, the father number was ringing, was not picking. They called the wife. Come, the wife say, my husband dropped my daughter in the house and went with the boy. They say, see, the boy is back in the school. That's good Samaritans have brought him. That's how the woman ran back to the school, saw the son. Where is your dad? My daddy is there, is there. Where? Could not say anything. The woman too. It was 12 midnight. He was calling the husband. The number, because they were beating him already.
Mm.
You have smoked it and you have brought your son. Now, what happened? So after all the drama, he now opened up that he took the son for them that he was owing them. So
Mm.
they decided to carry the son. So a lot of things happen. Drug users are suffering. A lot of things are happening in the society today, which the government, civil society, everybody has need to be on deck to save the situation.
That's quite terrible. Now let's move further to some positive things. So, can a young person fully recover from drug addiction? What does that journey look like?
It's an uphill task, but
Mm.
it can.
It's possible, but
Yes,
uphill.
yes, it's possible. I told you before now that addiction is a difficult thing. Then the solution is with the abuser, the user.
Mm. Mm.
I have a very good case. The person I'm talking now is a lecturer now in UST.
Oh.
He just came up 2023. 2023, yes. That 2022 he was admitted. The father brought him. That day they admitted him. He was shaking the whole place, trying to beat up the father. The man, old man, over 70. So the man was like, "Abemona, not let her come out. So please help me." I was like, that is not my unit, to the psychiatric side. I'm in the addiction side. So I now went in. I said, "Who is shouting there?" He said, "I mean, what is your problem?" I said, "Come on, shut up your mouth. Why are you shouting?" Eh, if I come out here now, I will. He was telling the father, if I come out here, I go smoke, I go drink. I say, if you smoke, you drink, who are you killing? Is it your father? I say, because the man is even begging you. I say, you should open gate and let him go and drink. If who will have the liver problem, who will have the kidney problem? Is it not you? Is it your dad? Where is your father begging you? I say, okay, beg you, because you are begging him, that is why he's shouting back at you. The man say, he's my only son. That is another problem. Why are people going into drugs? Parental overprotection.
Pampering.
Overprotection, overindulgence in everything. You want to be involved. The child, don't give the child sense of reasoning. I'm my only son. I say, and then, have you not seen people that don't have children? Don't they exist on this earth? So the man was like, hey, madam, leave. I just talked to the boy rashly that day I left. So the boy was discharged after 3 weeks. He came twice for checkup. He was okay. Then after some time he went back. He went back to drug full time. So one of these days, he just came round to my unit and I want to come for the application. I don't want the psychiatric ward. I just look at him. I said, please, out of my unit. He said, no, I've come. This person I'm talking to you came with his laptops. He's a graduate. He read 2 different courses, so, and he did well. When he was in school, he was not into drugs. It was after graduation because he schooled abroad.
I see.
He just came. I want rehabilitation. And I've gotten a contract to do music. So the person said, if I have drug in my system, they cannot take me. They will not employ me. And please, I said, you with all the jaga you came with, first of all, go to psychiatric ward. He said, no, I've already talked with the doctor. The doctor said I should come and discuss with you. I said, no, I will not admit you. Go. So the doctor now came and said, please, man, since he's ready, I should allow him. I said, this one, with all this load, the gongo load he brought, now this boy is stubborn, because we don't allow those things. We don't allow laptop, we don't allow phone. So I don't use it to be calling the dealers to be bringing it to the world. He now said, take. He handed over the phones to me. Myself, I was shocked. He gave me his laptop, his charger, everything, his ATM card, gave me. His wallet, not knowing that there was some stuff. He bought the cocaine while coming. So as that period, me and him was doing back and front movement, he ran down to go and sniff the rest.
Somebody that wanted rehabilitation.
He went to sniff the rest and that told me, I don't come. This time was not calm because once that withdrawal symptoms come, I don't come. And he just stayed for 3 weeks. Until today, he's off drugs.
Wow.
He just stayed for 3 weeks. And you know that God just used that white man to come and the white man left their community. The white man never came back for the because the person that chose him was the chief of their community that now let this our son. Since they knew a school abroad now, they say now if you follow a book, you should go. So they didn't know that they were just using it to a destiny helper. That was how he stopped the use of drugs. Today is one of our brand ambassadors for us. He always, anytime we're having mental health talk, we always bring him to talk. He speak. So we made him an ambassador. So being an ambassador now, you are not preaching against it. You can't go back. He has brought a lot of patients to us, even private patients to those of our doctors that have private facility. He has helped them a lot, connecting them with patients that are using drugs.
So how about those that are secretly doing this drug addiction? How can what are the first steps that they
It's for
can
them
take
to
to?
accept now. You must accept that this thing is a problem.
Okay.
You understand? You open up, speak
Open
out.
up,
If you
speak
don't
out.
speak out, nobody can help you. If I am thirsty and I see you with two bottles of water, I don't ask you, you will not give me now. You all will just that I want to preserve this one. But if I tell you, miracle, please, I'm thirsty, I need help. Can you help me with water? You gladly give me. So that is how drug is. Some people are using drugs. One, they are afraid the society. Maybe my father now is a pastor. What would the society say? Say, say pastor child. So many people are ashamed. Then the parents, how will my parents feel? You know, some of us, especially women, our emotions are very shallow. Instead of come, because addiction, like we were taught that addiction is any drug user is sick. The way we manage diabetes and hypertension, that is how you should manage a drug user. You should not take it that you see your life this. People that develop diabetes, some of them develop through careless living now. You understand? That's how they develop even BP. They develop it. Some people, you just see them, they will eat meat, eat meat. Before you know, their cholesterol start having problem. Before you know, they start having BP, renal problem. So that's how addiction is. Now we should not take them that they are the most foolish people, wayward people on earth. We should take it that this person is sick, he needs help. So once you know that this person is sick, he needs help, you bring them for treatment.
I think that you have actually entered into my next question, but let me still ask you, say, how can someone help a friend who is addicted without pushing them away? And then you can join that with what role should schools, parents, and churches play in prevention?
If you have a friend that's using drug, for you not to push that, if the friendship is positive, in quote, let me use positive, there are things you get, maybe that your friend is very intelligent, there are things you learn from this your friend, but this is use of drug is the issue. You should be able to talk one-on-one with the person that don't you think that this thing you are taking is not good. The effect may not be now, look at the future. Because some of them, especially those of them are busy marijuana, they will tell you na medicine. That's what they will always tell you. But do you know that the major cause of loss of memory is marijuana? Marijuana destroys the cognition very fast than cocaine.
Wow.
Once they take marijuana, that is, it's those of them that take marijuana that can't even complete their education, because it destroys their memory fast. It shut down that memory part in the brain, shut it down very, very fast. And lack of interest, that a motivation, marijuana does it very, very fast. So you should be able to tell the person all those things. Then the society, the school first. How can the school help? I like what University of Ilorin put up last week. Like my hospital, UPTH,
Yes.
our CMD have done that too. All the newly employed, they are going for undergoing drug tests. And Unilori, they are doing it. All the people that were employed, I think all of them, they asked all of them to stop. Then the students, this new intake, now this new year one, they did it. Those of them that were positive, they took them to a rehabilitation unit in the school for them to be undergoing counseling. They separated them from those that are not using. And that is a good start, so that you that is not using, you will not be influenced easily to join. Because how did they influence them? You know, in our tertiary institution, there are a lot of courtesan, so they will start oppressing them with court. When you see, they will say if you cannot beat them, you join them. Those that are feeble, that their home environment self is not even sweet, they will just see opportunity to have friends that they can rely on, because some parents don't talk to their children. So as parents, we need to do our homework. Let your children be your friend, so that you can easily pick out these signs from them. Once they are your friends, you pick out the signs. Then the church, enlightenment. There should be enlightenment everywhere.
So that means churches should do awareness,
Yes,
schools, there should
schools,
be a lot of awareness campaign,
awareness campaign.
and then
Schools should
drug
be
tests
doing
as well.
drug tests
Mm.
for every new
So that you can
intake.
identify them and help them
Early identification is
is
the
key.
best. Yes.
Okay.
Once you identify them early, you can
Now,
treat them.
now we know that sometimes they go into drugs to ease off stress. So what other ways can they ease off their stress and
There are a lot of ways to ease
without
off stress.
using drugs?
There's a lot of
How can they
our
deal with peer
what of
pressure, some of
those
these
days,
streets without
people
using
that when
drugs?
drugs was not as common like this. Those days, if you see somebody smoking in their home and they see police passing, they will run. But now, because our society is even those people you said to protect the people are the ones selling it.
Mm.
They are guiding the people selling it. Our politicians, they are the ones causing this problem. You see, politicians have gotten talks. What do they give them? It's drugs. It's drugs they are giving them to do all this. Politicians are our problem.
Mm.
The political circle, the cabals, they are using this youth to fight their opponent. And what are they giving them is drugs. Because if you don't use drugs, you will not be violent. You will not think of killing your another person. But because of this drug use, that is why you see them. So the society have a role to play.
So finally, I would like to ask you, what's your heartfelt message? So final message to every youth out there listening. What can you tell them?
I will tell them, say no to drugs. There's nothing in drug use. There is nothing. It's not your friend. It's an enemy, a very deadly enemy that can hamper your life, destroy your careers, destroy your dreams, and everything you think of in life. The sky, some people say, is the beginning, but when you use drug, the floor cannot even contain you because you will
Go
be
on
below
down.
the floor. So it's better you say no to drug. Say no to drug and run from peers that will influence you to use drugs, and learn to speak out. The way they tell those people that are raped, speak out. Learn to speak out. If it means the friend say, I don't want to be your friend again, it's better you speak out and save your life and save your future. That is all I have to say. And as parents, be at alert. This one, we call it red alert. Because the society we are now, even in the primary school, they do drugs. Secondary school, they do drugs. So university is baba. So you should be at alert.
Thank you very much, Ma. Thank you for this wonderful session of lending your voice to this drug abuse campaign. We are really grateful for the time.
Thank you.
And we hope that when we invite you next time, you'll be available. And so that's it for this episode. Join us next time for another interesting episode where we inspire, we inform, we ignite greatness in the young generation, students in high school, in tertiary institution, and young adults. This is the channel for you. So if you have not hit that subscribe button, hit it now and turn on the notification so that you'll be aware when we post our next video. Till then, keep the fire burning. Thank you.